Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. I am an American Board Certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about aesthetics in urology. Today, I have the distinct privilege of having Dr. Lanna Cheuck on with me today, and she will be discussing what she does in her office. And Dr. Lanna is a board certified urologist that now does aesthetics such as Botox and fillers, and now also aesthetics in the urology. So, but before I get into it, the first thing I want to make very clear is that I am not giving any type of religious or medical advice. If you have any concerns about your health, please speak to your medical provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader. It's the Muslim Sex Podcast because I just happen to be a Muslim woman who talks about sex. So now, Dr. Lanna, if you could just tell our viewers and our listeners exactly, maybe a little bit about yourself and then what it is that you do.
Absolutely. First of all, I'm so excited to be on here, Sadaf. You and I go way back, and I started out as a urologist, so as a urologic surgeon. I trained at Brown, did a fellowship in robotics, so I do a lot of patients with kidney stones, prostate cancer, kidney cancer, tumors, and really just curing patients of their cancers and ailments and all urologic issues, including urinary as well, and we also treat some infertility as well. About 10 years into my journey, I realized that I really loved being artistic and really had an eye for aesthetics. And then I kind of transitioned into the aesthetics field. And, within 5 years, I was really able to kind of grow multiple businesses from my aesthetics. And now I focus on training other practitioners who want to get into the field of aesthetics. And, I feel like, we've become from physician to kind of an entrepreneur of sorts. And we kind of keep reinventing ourselves. And I think that's important to know, as physicians, that it's okay to reinvent yourself and to do something else that you're really passionate about to help people and make them happy.
Absolutely. Yeah. What you just said about reinventing yourself, I feel like I've gone through that journey and am still going through that journey several times over on my end as well. So I completely understand and I appreciate that you, can be vulnerable and also talk about that yourself. So that's amazing. So tell me a little bit. I know that you train other physicians, so that's amazing. But tell me a little bit about like the aesthetics in urology. What is that all about?
Sure. So aesthetics in urology is basically anyone that comes in who wants improvement in not only kind of functional, but cosmetic of their genital areas. For men, we go through a lot of different treatments because, one of the issues with men is obviously the functional issue of erectile dysfunction. I know you guys have talked about that in the past on your podcast. But, we offer a lot of treatments for erectile dysfunction, but, there are men who just want, their genitalia to look a different way, right? Whether it's circumcised, uncircumcised, partially circumcised, etc., but also augmenting what they have. And then that's also been a really hot topic and something that's really more, out there now as far as augmenting the girth, of the penis.
Okay. So how do you go about doing that? How does, you as a urologist will go about increasing the girth of, say, a man's penis when he's not satisfied with that, I guess?
Right. So the majority of patients that we see that come to us are those who, have issues with girth. I mean, length is a different thing. I mean, there are ways that we can increase the length. And I'll just kind of talk about historically what's been done and how that didn't work and how we've kind of got to where we are now. So historically, what we used to do was we used to, when I say we, meaning urologist, before I've actually never done this procedure because it's actually out of vogue now. It's not recommended to do this procedure, but we used to cut the suspensory ligament of the penis. And so what happens is, what you're seeing as far as the penile shaft externally is actually tethered to your pubic bone by ligaments, right? And so some patients have had surgeries in which that ligament has been incised. And after incising that ligament, they have more mobility and more length just because there's more mobility of that shaft to go from kind of internal to kind of external. It's almost like a hammock. So it's almost like it's more mobile. So they're able to have that mobility. The problem that we saw with that technique is that even though we incised the ligaments of the penile shaft, we saw that there was a lot of scar tissue that happened afterwards. And sometimes when you get scarring, as you guys all know, things can contract and look even smaller, right? And so that's something that we definitely want to prevent. And so nowadays we can augment the penis with fillers. That's non-surgically. There are plastic surgeons, urologists doing that with fillers. And then there are also urologists and plastic surgeons that are using silicone implants to place underneath the dartos and onto the corpora cavernosa, which in anatomy is basically just kind of onto the two bodies of the shaft. And that silicone that's placed underneath the skin and on bucks and underneath dartos is sutured in place, so it's tacked in place. And so when you have, in the flaccid state, the penis appears more, longer and larger girth.
How does that affect the function? Does it affect function? Is it, for example, is a man still able to attain an erection? I would assume so.
Yes. So before these implants were discovered, and it was discovered by Dr. Ellis and Dr. Panuma. These are called Panuma implants. They we obviously we place in the three-piece penile prosthesis or the one-piece. These penile prosthesis are cylinders that are placed into the corporal bodies, and then there's a pump and a reservoir, and we place the pump into one of the scrotal compartments, and then the patients pump themselves, and then the water from the reservoir goes into the cylinders into the corporal bodies, and then they are able to get an erection. And in order for them to detumesce and decrease erection, they kind of push a valve into their scrotum to detumesce that. And what they found was that in certain instances, if you place that, kind of after having a radical prostatectomy, meaning prostate cancer, taking out the prostate, the more, I would say kind of the more blood flow and the more you use it, you really sustain that erectile length. So one way to prevent penile shortening, especially after surgery, especially after cancer surgery, radical prostatectomy, is by putting in penile prosthesis to elongate things. But this is different because that's more for function. Those are for patients who, are no longer able to sustain or even obtain an erection. This Pneuma implant is completely cosmetic. It actually stays on top of the corporal bodies. It does not affect function. It does not affect orgasm. It does not affect sensitivity or pleasure if done the correct way.
Interesting. And how long does that procedure take?
So the pneuma implants will take anywhere between 1 to 2 hours, and it's done mostly by urologists and plastic surgeons, and those are the only two, uh, the only two. I would say people that can actually do this at this time. It's not for everyone, and you have to be very careful because here's the thing, right? If you're putting something a little bit more superficially over the corporal bodies, you want to make sure that it doesn't move, it doesn't erode, it doesn't get infected. Because any implants that we have in our bodies, we have to make sure that we don't get them infected and we don't introduce bacteria to them. That's why it's really important during the procedure, any procedures that we put implants, to really make sure that everything is cleaned very well. So we do like 10 to 15 minutes of scrubbing, dual scrubbing, and no outside people in the room. Basically, we keep the doors closed. Once everybody's in, that stays as sterile as possible.
Sure. So, I think you mentioned a little bit, but just in case some of our viewers may have missed it, what would be an indication for to have this implant for a man? So, I know you said after prostate cancer, right?
Yes, prostate cancer for the I would say the normal implantable penile prosthesis.
Okay.
For this specific called the pneuma
Mhm.
prosthesis, which is just for cosmetics, I would say the indications are the men coming, and this is not a procedure that I do regularly, but my colleague, Dr. Robert Valenzuela, I'm going to give him a shout out over at Mount Sinai. He does this regularly, and we talk about this all the time because he was trained to do this, and he is so busy. He tells me that he books up like months in advance of like
Wow.
these prostheses all day, and it's all cash out of pocket. But the indications are really for anybody who feels that they want to increase their girth, and they call it more like a locker room penis because as you're erect, the erectile tissues fill up with blood, and so you do get the girth and you do get the length. But in these patients, when they're flaccid, they also want to be girthier, if that's a word, right? They want to really kind of, I want to say show off, but they want to look like they have girth to them. So they call this kind of like a locker room penis because one thing that we have to make sure of is when these prostheses are placed, that it doesn't move and that it feels very natural. Because the last thing you want is this, this penile augmentation to cosmetically be desirable, but when you're actually engaging in intercourse, it's felt, it's palpable, it's not sutured in correct, sutured in the right place, and it kind of is mobile or moves or gives you any deformity of the skin or rippling defects and things like that. So that's why I feel like this has to be done by either urologists who are experts in the field or by plastic surgeons who have to be very well trained to do this procedure.
Sure. I guess you'd also worry about putting an implant on the penis too tight, right? And cutting off any type of blood supply.
Yes, for
Um,
sure. I think any type of, and also like nerve damage, right, etc. We
yeah,
have,
right.
a dorsal penile nerve, artery, vein, and you want to make sure that you're not severing any of these important structures as you're placing the implant and dissecting down to it. So there's specific ways of doing that to stay safe and be careful with the anatomy. So getting back to some of the non-surgical ways of the penile augmentation, a lot of people now are doing fillers, and fillers,
Mhm.
as you know, are FDA approved for face, but it's off label for body and specifically for labia and for penile augmentation. But it is being done, and a lot of people are doing it.
So I guess the same reason would apply in terms of why they want that done. And I assume it's to increase girth, right? So instead of putting that implant on the penis, then you'd be using fillers.
Yes, and the fillers have to be placed in such a way that it's not going into any vascular structure. So it has to be done by a professional who knows what they're doing. And this is not to say that, this is something that everyone should be doing. It's really not. There are people out there doing it. And so I just wanted to, come on with you just to talk about how they do it, why they do it, etc. How they do it is either using a needle or using a cannula and staying superficial to the corporal bodies of erectile tissue. And what that means is you're really putting it superficial to the tunica albuginea and to buccal fascia. So you're putting on top of buccal fascia between dartos and buccal fascia. And what that means is that you have to get it all around circumferentially in such a way that it's going to be very natural, right? But we all know that the penile anatomy is such that the ventral, meaning the front side of the penis, is where we house our urethra, right? Where we urinate through, the hole that we urinate through. And so you have to be very careful not to get any filler into that compartment of the penis, because that would be devastating to get filler into the urethra or around the urethra, or any injury to the urethra itself. So I always say cannula is probably safer than needle in this area, and it has to be such that it's not lumpy bumpy and the patients are not, touching it, using it, so forth, which can be difficult, right? Because a lot of men get what we call nocturnal tumescence, nighttime erections. So you really want that patient to not become erect, and definitely not be sexually active for quite some time afterwards, to decrease the risk of bulking, bunching, and lumpy bumpiness.
Well, I guess so. A lot of things for somebody to think about if they're really considering this. And I can imagine that it would be horrible actually to get that filler into the urethra itself, right? I mean, you're basically blocking the individual wouldn't be able to urinate, right?
Absolutely. Right. Absolutely.
Yeah.
There are some times that hyaluronic acid can be placed in the bladder neck area to kind of bulk it up, like Bulkamid, etc. Where patients are incontinent, meaning urine just kind of leaks out uncontrollably. And in those cases, we do endoscopically, we call it cystoscopically, we put in a little camera into the urethra, into the bladder neck, and then inject a bulking substance, either hyaluronic acid, like you see with your facial fillers, calcium hydroxyapatite, like you see with like our Radiesse for face, and that's injected into the bladder neck, and in order to increase that urethral resistance to decrease the risk of incontinence. But yes, if you go through any structure you're not supposed to go through, or let's just say you go into the corpora cavernosa where there's blood sinusoids, right? You can actually cause a vascular occlusion of the penis. So you don't want to get it into anywhere that can cause vascular occlusion, because that's when you get tissue death, and that organ dies, the skin, etc.
Yeah, absolutely. So that's why it's so important, right, for any of our viewers or anyone listening to this that is interested in something, aesthetics and urology, that it's so important to go to a physician. I wouldn't go to somebody that is, I don't know, just trained or watch some YouTube video at home or something like that, and is now trying to get clients and patients to do this procedure on. You want to make sure you go to somebody that actually understands and knows the anatomy. And that's why it's important for men or for individuals that decide to have this procedure done to go to a urologist or a plastic surgeon that is trained in this type of procedure. So that's why it's so important.
Absolutely. That's such a great point, because I know nowadays everybody wants to get into the aesthetics field, but we want to make sure that
Right.
patients, that patients understand what needs to go into your training and education before you go to somebody. So, yeah, so important.
Absolutely, absolutely. So, can you explain to our viewers what like is a P shot and an O shot? I know that those have been advertised, and just so I know what they are, but just so for the
Sure.
viewers that don't know what they are, perhaps you can talk about that a little bit.
Absolutely. So, regenerative medicine is such a huge field nowadays, right? It kind of started, I would say, probably like 5 to 7 years ago, and it just becomes so big because we realized that if we take, platelets from our own blood, and growth factors, and signaling cells, and re-inject it into certain areas of our body, that we're basically causing our body to kind of re-stimulate collagen building, etc. And so we now know that if we took out our blood, spun it down, get our platelets, and then re-inject it back into our face or into our body, it's really tricking our bodies to say, you know what, we're not done making collagen yet, so let's start making more collagen. And so with the P shot, it's actually called the Pri-Pis shot, P shot for short, and the O shot, is something that Charles Runnels had kind of put out there in his, licensing of the vampire facial, etc. But basically, it's penile PRP and vaginal PRP. And what that is with women, we do a lot of vaginal PRP. We take their blood, we spin it down, we have a really good system, and then we take out all the good growth factors from the blood, and then we re-inject it back. And we re-inject it back into several different areas. One area, right, is going to be the area of the bladder neck. And the reason why that is because you have patients, as you said earlier, who have incontinence, leakage of urine, right? And that could be stress related, meaning anytime you valsalva, anytime you bear down, anytime you cough or sneeze, do a jumping jack, whether pre or post babies, you'll have some leakage. And patients think that they have to live with it, but they actually don't have to live with it. And so one of the things that we do is we inject this PRP back into that area. We don't need to do it endoscopically. We just inject it from the outside in. It's your own plasma, it's your own platelets. So there's really minimal risk there. And then we also inject it into the clitoral hood and into the body of the clitoris so that you can get more sensation for those patients who feel like everything is dead down there after having babies. And then there's also a spot that we inject called the G spot, right? And so a lot of patients are always asking, well, is that a real thing? I don't know if I have one. I don't know what it is. I don't think everyone's ever found it, but it sure is a definite location of the confluence of a lot of nerves in the vaginal canal. And what I do is I go ahead and I examine them beforehand. And after I examine them, I always check to see, is this area very sensitive for you? And they will tell you yes. So you have to know whether it's to the right, to the left, or central in the area where you feel the ridges kind of more proximal to your anterior fornix. And after doing so, you'll know exactly where that is. And we inject PRP into the G spot. And our patients are so happy afterwards. It's really life changing for them. Just to give you a quick little testimonial of one of my dear patients who's had this done, and how they explained it was, it's basically putting like a big bullseye, like a big target to their G spot, so that even if their partner is somewhere close to there, they're able to feel it so much more. And so that sensitivity, the sensation is so much more amplified that they're able to have not only multiple orgasms vaginally, but even for those who have never had orgasms with vaginal intercourse, they're now able to, or very, very close to having orgasms with penetration.
So, Dr. Lana, you were mentioning about the O shot and the P shot, and I think that the O shot is great for women, especially if they haven't been able to experience a vaginal orgasm and they need help with it. I think it's great that you provide that service. Maybe you can just tell our listeners a little bit about how long the results last with an O shot and with a P shot.
Sure. That's a great question. So, usually, what we tell our patients is they need 3 sessions, one session, 1 month apart times three. And we've seen results last 12 to 18 months. Our
Wow.
last patient that we did, just because it's fresh in my mind because she was just here about 2 weeks ago, she actually is a divorcee who's just started dating out there, and and she's very open about her story. And she had a child, and she just felt like nothing was working down there, and she had no idea about this. But then she saw my website and said, you know what, let me just go ahead and get a consultation and see what this is all about. So she comes in. She explains to me that she feels nothing, and that she wants to be intimate with her new partner, but is super scared, and just thought that this was normal part after childbirth. And so I did the O shot on her, the vaginal PRP, and she was so happy that she literally texted me after after being with her partner, and she was just saying, like 10 out of 10, it was amazing. She's so happy. Her life has changed forever. A year later, and she just had that one. A year later, she comes back and she's like, everything was going so great. I forgot that I actually had this issue. And then I started feeling like I needed another one. So we did another one. And again, 10 out of 10, super happy. So I do know that it can be prolonged, for a year. But it's important to understand for women, especially with, who have, it's multifactorial with orgasms, that, a lot of it is also like mental as well, right? Psychological, emotional, etc. But for sure, everyone across the board is telling me how much improvement they've gotten. So I would say about a year or more. For males, a little bit more variable. I would say at least 6 months to a year.
Okay. And, it's so important that you mentioned that for women, intimacy tends to be biopsychosocial. And in fact, I have a whole podcast on that regarding the emotional connection and the emotional intimacy that women, crave when they, in terms of choosing a spouse or a partner. And, it's important that you also mentioned that with orgasm, right? That in fact, oftentimes we forget that the biggest sexual organ for women is their brain, right? And they have
Absolutely.
to use a lot of mindfulness and just be present in the moment in order to feel and to experience orgasm. And in fact, a lot of times it's the how well their relationship is that determines, whether or not they're even able to approach intimacy or to have that orgasm. So I'm glad you brought that up, and that's so true.
Absolutely.
Sure, sure. No, I know that's very important to a lot of our listeners. And, as you know, there's multiple ways to get orgasms, but you're right in terms of that vaginal orgasm that often women think that they need to have. That PRP, I'm sure, is very important. The O shot, I'm sure it would be very important for them to be able to experience a vaginal orgasm. And you talk about those nerve endings. I know that they recently changed the nomenclature. I think they, instead of the G spot, they call it the G zone because of all of those nerves that confluence right on the anterior vaginal wall, and that it's a bigger area now. But yeah, I'm sure just injecting into that area would help to promote having a vaginal orgasm. So I can see how that would be helpful.
Absolutely. And it's for the women who come into our practice who didn't realize that, they're not they that they were missing out on this, right? And also a lot of the men who come in are very happy to have their wives come in, and also they come in and get the P shot. So yeah, we could definitely go into what that means for a male as well. I find PRP in men a little bit more, I would say, more variable when it comes to the outcome because for men, they could have a lot of other issues that's going on, right, with their erections. A lot of times we have men come and just say, you know what, Dr. Lana, I really just want to have some enhancement. I don't have any issues with my erections, whether that's true or not, but they coming in because they want improved erections, stronger erections, more durable erections. And so I think that's also important to know too, is that, this is not just for those who have a degree of erectile dysfunction, that it's also for those who have healthy erections, but really just want a little bit more robust erections. But I think that PRP works best in those with mild erectile dysfunction. So like, according to our validated IIEF score, that's a validated symptom score of like how bad your erections are. If they're on the mild, category, I would say that this is definitely a good option for them. And then we also combine it with shockwave therapy as well. I can discuss about that a little bit later as well. And then there are those who really don't get any erections at all, whether it's post procedurally or iatrogenic or diabetes or any other. Kind of cardiac condition that they have and that they're unable to have erections, because we know erections, in order to get good erections, you definitely have to have a strong heart, you have to have good blood vessels, et cetera, et cetera. So, for those patients, I would say PRP is probably not indicated for those patients, but it's probably more for penile enhancement versus more for erectile dysfunction.
It's all great information for our individuals that are listening that may be interested in something, PRP related for men and for women, in terms of enhancing their, whether it's erections or their orgasms. It's important for them to know who they can reach out to and if that's something that they're interested in. So that's excellent. What were you talking about in terms of shockwave? I don't know anything.
Shockwave, yeah, for sure. So one of the things that has been more developed and talked about in the recent, I would say, probably the recent 5 years, is really the idea of using shockwave, low intensity shockwave therapy. So, low intensity shockwave therapy is actually talked a lot about in the literature when it comes to urologists. And we've talked about this in our annual American Urological Association now for years. Still considered experimental at this point because there's not been any good validated studies to show its benefit. But patients are asking for it, right? So when patients are asking for it, so what it is, it's using shockwave. So shockwave is something that urologists use a lot of. We use it for kidney stones to really break up kidney stones, and it's also used for like plantar fasciitis. In fact, shockwave is one of the FDA-approved treatments for plantar fasciitis, meaning like fascia issues with the plantar aspect of your foot, and so somebody thought, well, what would happen if we use this low intensity shockwave and we applied it to the penile tissues, right? Would it increase erections? How would it do it? Does it cause angiogenesis, meaning like, new blood growth? And I think that's the idea, is it actually promotes more angiogenesis. So more blood growth to the penis means more blood flow into the penis, which means bigger and better erections. And the way that we do this is it's a machine and there's a probe. The probe is then placed on the shaft of the penis all the way to the core, so from the distal end all the way to the core, back and forth, and we deliver a couple of thousand shocks to each side. And then we also have PRP added into their sessions as well. Our patients typically get a total of 6 sessions of shockwave and then 3 sessions of PRP for one full treatment algorithm. And our patients are very happy. What they're usually saying afterwards is that they feel that their erections are more spontaneous. They're able to get more durability of their erections and more firmer, harder erections. So on the EHS score, the erection hardness score, it definitely score higher on that after having these procedures done.
Wow, that sounds painful. Those shock waves and putting a
You know, it's interesting. It does sound painful because you're thinking, you're thinking like a Theragun on your back sometimes hurts, right? You're like, how does this feel down there? It's actually, believe it or not, used also for chronic pain, pelvic pain, and people are using it for like pelvic floor dysfunction, chronic prostatitis. They're looking into. It's one of those things where initially you kind of feel it's not like shocks as in like electrocuting. It's just kind of like a almost like a mechanical like a little punch there, but not like a really heavy punch. But what it feels like to them is that they have this thing kind of like pump, like like a massager, but a little bit more firm. And but after a couple of minutes, they actually don't feel it anymore. So I think it's kind of like your body's way, right, of like decreasing all the sensation, so you don't really
yeah.
feel it as much. So they actually tolerate it pretty well. We don't even have to numb these
Maybe
patients.
it's like a desensitization type thing, I guess, once they start. Yeah.
Exactly. Yes.
Wow. Well, that was very informative, Dr. Lana. Any parting thoughts that you want to give our viewers or our listeners regarding aesthetics in urology?
Yeah, so I think you said it really well in the beginning, Dr. Sadaf. I think you said, you just have to be very careful about who you're going to. You have to go to someone who's really well trained. And this goes for aesthetics, for face, and for anything, urology related. I think it's really important that that you're going to a physician that has been trained in all this and that have done procedures in the past. For our patients and listeners, I think that if you guys have any questions, you guys can always reach out. I'm on Instagram. We follow each other, Dr. Sadaf, as Dr. Lana, DoctorLanna, and I'm happy to answer any other questions. I know that this is kind of like a taboo discussion, but I love that you have this platform for people to come, listen, ask questions without any judgment. So thank you for doing that for us.
Yes, and thank you, Dr. Lana. This was very interesting. Definitely, I've definitely not had anyone else talk about this particular topic. So I'm glad that our patients do have a resource like you who's board certified in urology and yet still does aesthetics and can give the care that patients need and want. There's no judgment with that. And it's available with if they want it. And just remind our patients where you're located. I know it's in New York City and Manhattan.
Yes, we are at 140 West 58th Street at Central Park South. And yeah, we would love to have you guys come, and we could talk about any of the sexual health and or aesthetic needs that you have.
All right, great. Well, thank you so much, Dr. Lana. And
Well, thank you for having me.
thank you. So, well, I am done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So, please see your healthcare provider for any concerns that you might have. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.